Hi, I'm Carolyn Phillips. I've lived here in Longmont for 17 years. You know, I just lucked in to have Dr. Lysette. She has a wonderful reputation, and geriatric training is meaningful to a lot of people.
I got into geriatric medicine because I love the stories that older people tell. They've lived a long life, they have interesting things behind them, and that also helps craft what they want and why they want it. And that's part of what we do in geriatric medicine, is to try to get people the best quality of life that they decide on.
Most of our patients, at certain ages, their goals change. They really want to focus on quality of life issues, making sure they stay mobile, can hear. And when we think about all that we have to offer, all of the life-saving technologies that we have to offer, sometimes they're not appropriate.
The most important thing I can say about her is she lets me be old. She doesn't insist that I try to do all the good things that would be good for me to do in the long run or any of that. She knows what my limitations are, and I've appreciated that.
The benefits of a geriatric program is often a little bit more time to listen to patients and really focus on the palliative care of aging, because if all you do is focus on just the medicine, it is wildly complicated and patients don't really know how to prioritize. They just go to doctor after doctor, obediently following through and really losing focus on what's important to them.
There are lots of different providers providing lots of different services. A lot of them don't even know what services they need. A solution to trying to deal with all these overwhelming choices is to have a person guide you, a person that you're in relationship, who you trust, who can help guide you to the places and to the people to get the care that you need.
The thing that has turned the whole thing into an awesome geriatric experience has been the addition of Michelle's role. Being able to call that nurse and tell her what's going on, knowing it would get to the doctor without an appointment, has been what has made the difference.
One of my biggest roles is being a facilitator and helping a patient understand when they've gone to see a specialist. I will get involved and help them interpret what the specialist advised, what Dr. Lysette feels is important, and then helping them further manage their care.
She and I literally work elbow to elbow, helping manage patients and keep them out of the hospital. So while I might be seeing patients in the clinic, Michelle is on the phone helping triage who has chest pain, who can't breathe, who didn't sleep last night, who's having side effects from medications, and helping keep those patients out of the hospital.
Having the two of them working together, I feel like I've had far better care, much more specific, much more dependable care.
They have access to my direct line, so I'm on the phone all the time, helping reinforce what the plan of care is, and just being able to listen to them as well I think is very key.
My goals to increase geriatric care at BCH is to provide a community resource where medically complicated elders have a medical home that can really focus in on their goals. And what we're building is a giant team of awesome people that are really good at supporting patients in that idea.
I can't tell you how excited it is for me to be a partner with Dr. Lysette. And the idea that we're going to make Boulder a center of excellence as it relates to geriatrics, and she's going to run the ship, just warms my heart. She is caring, compassionate. She has the skill set to manage all these complex issues as it relates to our geriatric populations, and it will be a tremendous, tremendous boon to our community. And since our mission is to care for the population here in town, we need to be prepared for the growing geriatric population that is arriving.
You go to your pediatrician for your babies. We all needed family med when we were a family. We all need geriatrics when we get older. And someone who understands what we're going through.
The role of a navigator to really hone down on what people want, especially towards the end of their life, will be invaluable. Not only in making sure we deliver those things, but also so that we don't deliver services that patients really don't want.
She lets me deal. She knows what part of my lifespan I'm dealing with and is willing to treat it realistically. And that's the part that I have valued the most.